Hi, I'm Dr. I am the medical director for sleep here at Bluepoint Medical Associates. I'm here today to talk about sleep apnea. Sleep apnea is cessation of breathing while we are sleeping. In the United States, it is estimated there are about 22 million people with sleep apnea. Only 20% are diagnosed. So if you look at it, there are 80% of people in our society that are not diagnosed yet. Now, the way to know if we may have sleep apnea is there is some association with family history. If anybody is diagnosed with sleep apnea in your immediate family, that could be an indication. The symptoms are patient snores, they stop breathing. The spouse or a family member may notice that the patient stopped breathing, and they may thrash while sleeping. They may gasp for breath. The patient would wake up and the sleep is not refreshed. They feel tired in the morning. During the day, they fall asleep while engaged in passive activities, reading, watching TV, sometimes even driving. Other symptoms include morning headaches and dry mouth in the morning. In addition to those, if you have high blood pressure or if you have diabetes, those are also indication for screening for sleep apnea. The treatment options, one may differ by the severity of sleep apnea, but surgery is an option. This is where an ear, nose, and throat surgeon would do a surgical procedure to widen your airway. The second option is dental appliance. A dentist can construct a dental appliance that would keep your airway open that you use at night. These are mainly for mild, or moderate sleep apnea. The third option is CPAP therapy. This is the machine and a mask that blows air into your airway to keep it open. It works as a splint, and this can work for mild, moderate, severe sleep apnea. And the fourth one is something that FDA approved recently. It's just coming out in the market, is a pacemaker that would treat sleep apnea, especially moderate and severe sleep apnea. Sleep apnea is now termed as a silent killer because people don't realize that the complications that can come from sleep apnea. Now, sleep apnea can lead to high blood pressure. 1 out of 4 patients with high blood pressure have sleep apnea. It can lead to type 2 diabetes. 3 out of 4 type 2 diabetics have sleep apnea. The risk for stroke is high in sleep apnea patients who are untreated. Risk for heart attack is high. It can lead to to atrial fibrillation, one of the irregular heartbeats, and also it can lead to heart failure. So if you look at the consequence of not treating sleep apnea is huge. If you look at sleep apnea, the biggest risk factors are, one is genetic structure, having genetically narrow airway, but one of the other biggest risk factor is weight. So the more weight we gain, the more weight we accumulate in our neck area, the more tissue, and that can make the airway crowded. Given the rates and prevalence of obesity, we're seeing more and more people with sleep apnea. Now, losing weight definitely helps manage sleep apnea, but also addressing sleep apnea can also help in losing weight. So those two are closely related. And at Bluepoint, one of the things we have is we have a combination of sleep medicine and weight loss center. So we're addressing both at the same time. So that can have a bigger impact on patients, because our goal is to diagnose sleep apnea, but also to make sure that it's adequately treated so you can get the benefit from the treatment. We've had many successful stories from our patients who are treated for sleep apnea. One particular patient, after a car accident, this particular patient fell asleep behind wheels, and he was referred to us for evaluation of sleep apnea. He turned out to have severe sleep apnea. So We diagnosed him, we treated him, and when he came back for follow-up, he was literally in tears, and he stated that he never felt that way for the last 20 to 30 years. He felt more energetic. He lost about 16 pounds in the first 2 weeks of treatment. He stopped taking naps during the day. His blood pressure was better controlled. He actually got off from, 1 out of 3 of his medications. We've had many of, stories like that from patients who are treated with sleep apnea.
My name is Hannah Moon. I'm a nurse practitioner for Bluepoint Medical Associates, and I see sleep consultations. Insomnia is difficulty initiating or maintaining sleep despite adequate opportunity, leading to daytime impairment. So at Bluepoint Medical, we take detailed history regarding your sleep hygiene and the hours that you sleep in the weekdays and the weekends. We assess how long it takes for you to initiate sleep, how long it takes for you to fall asleep, how long you're sleeping for, how often you wake up in the middle of the night, and for each of those arousals, how long are you up for, and what is causing those arousals. We also assess how early you wake up despite trying to sleep. There are 2 types of insomnia. One is acute and the second is chronic. Acute is easy to identify. There's a specific trigger or stressor. For example, you've lost a loved one, you've lost a job, or something has happened, like a trauma. Chronic is when you have insomnia symptoms at least 3 times a week for 3 months or longer. It's usually harder to identify the causes of chronic insomnia. So there are 2 causes of insomnia, primary and secondary. Primary is usually related to poor sleep hygiene behaviors. For example, they're looking at the clock when they wake up in the middle of the night. Some patients exercise too late in the evening, very close to their bedtime, having a separate or inconsistent schedule for weekday and weeknight. People are drinking caffeine way too late in the afternoon. They don't realize that the caffeine stays in your body for about 8 hours or longer. Secondary insomnia is when the cause is related to another health problem. For example, restless leg syndrome, in which you're moving your legs while you're awake. Periodic limb movement syndrome, when you're moving your legs when you're sleeping. Having acid reflux that's not controlled, asthma that's not controlled. It's also related to mood disorders such as anxiety or depression. Sometimes the thyroid level, whether it's low or high, it can affect the quality of your sleep. Or even pain such as fibromyalgia. All these are comorbidities that can affect your sleep. Many people start to drink alcohol because it helps them fall asleep, but alcohol abuse and drug abuse will also cause secondary insomnia. Often people start to drink because it helps them relax and fall asleep, but they'll quickly learn that when the alcohol wears off, it actually causes arousal. There are certain medications that are associated with insomnia. The medication can cause insomnia or make it worse. Some of the medications that are known to affect your sleep are depression medications in the SSRI class, blood pressure medications in the beta blocker class, decongestants such as cold medicine or allergy medicine purchased over the counter, or any kind of steroid. They all affect your quality of sleep. At Bluepoint Medical, we focus most on behavior modifications. We try to identify any poor sleep hygienes that you've been practicing over the years. When medically indicated, we order overnight sleep studies to rule out any organic disorders such as breathing disorder or leg movement. We sometimes refer patients for cognitive therapy to manage anxiety and depression that may have been undiagnosed. When necessary, we have the options of using sleep aids, medications to help you fall asleep or stay asleep. We'll prescribe the medications depending on your symptom. For patients looking for alternative therapy rather than relying on medications alone, we now offer electrotherapy in the treatment of anxiety, depression, and insomnia. It can be used alone or as adjunct therapy to sleep aid.
I'm Dr. Halmi, bariatric surgeon. I'm with Bluepoint Medical Associates. So you qualify for weight loss surgery if you have a body mass index or BMI is over 35. You can find out your body mass index if you look at your height and weight, and there are different tables where you can look up your body mass index. If you have tried losing weight in the past and you were not successful and your body mass index is over 35, you can consider weight loss surgery. You will be a good candidate if you understand that weight loss surgery requires many changes in your eating and in your behavior. Those changes are difficult, but if you are determined, you will be very successful. There are different types of surgeries that we do. Each surgery, however, works almost the same way. What the surgery does, it helps to eat less, to get full with a smaller portion of food, and to stay full longer. The gastric bypass is one of the oldest weight loss surgical procedures. It has been done for at least 30 years. Thousands of patients had gastric bypass. It is a very successful, very effective procedure. What it does, it creates a very small stomach, which is about the size of an egg. And this small stomach is connected to the small intestine. So when someone after a gastric bypass eats, a small amount of food will fill you and the food will bypass the stomach. This will control your hunger, the appetite, provides fullness, and also because the food doesn't get completely digested and absorbed, it helps with weight loss. Very effective operation. However, due to the bypass, it does have some nutritional side effects which need to be prevented by taking vitamins and minerals. The sleeve gastrectomy is a little less drastic procedure than the gastric bypass. However, it's equally effective and successful in weight loss. With the sleeve gastrectomy, we completely remove about 75% of the bottom of the stomach. So after the procedure, the stomach, which normally looks like a football, it will look like a narrow tube. Because of this, the food portion will be reduced. You will be satisfied by eating about a cup of food, and the hunger and the appetite is very well controlled by removing the lower part of the stomach. This procedure has a little bit less nutritional risk, less vitamin deficiencies. The gastric band or lap band is when we place a small plastic ring around the upper end of the stomach. By adjusting the tightness of this ring, we can delay the passage of the food through the stomach. Because of this, the eating will slow down, the fullness will last longer, and therefore you can lose weight. The band, however, does require more follow-up and band adjustments. The procedures are chosen by the patient. My role is to help to explain the difference between the procedures so we can make a decision together with the patient for the procedure that will fit the patient's lifestyle expectations the best. So we have a unique program at Bluepoint. Our goal is to help to lose weight, but our ultimate goal is really to help to maintain the weight loss and to have a successful, healthy life. In order to do that, we offer more than just an operation. Our program starts before surgery with nutritional education, exercise guidance, Following the operation, we continue with regular checkups, medical follow-up, dietary guidance, weight management. Also, we offer exercise, and for real quality of life improvement, we do skincare, offer massage and cooking classes. So one of my favorite places to go to is our regular support group meetings. These are meetings where our patients come and share their experiences. And on those meetings, we see patients who had surgeries many years in the past, and we see patients who just had their surgeries. And it's always a very lively discussion. And I learn a lot on those support group meetings. I see amazing stories, patients who struggled with obesity and were almost disabled because of their excess weight, and then they became athletes. They run 5K races, they exercise on a daily basis, and they tell me that they never ever thought that they would do any of this before they had the surgery. I do see patients whose life completely changes after the surgery. They go through this transformation. I don't recognize them because they look so different, they dress different, they radiate some sort of happiness that was not there before. And this is so amazing, and this is probably the biggest reward I get from my profession.
Hi, I'm Dr. Chris Coe. I am an internist and I am in charge of the Medical Weight Management Program here at Bluepoint Medical Associates. The Medical Weight Management Program at Bluepoint Medical Associates is designed for anyone who is interested in losing weight but is either not a candidate for surgery or would like to pursue non-surgical options. Some people have come to me either confused or frustrated because they haven't been able to lose weight on their own, and others come to me because they've lost weight but they haven't been able to sustain that weight loss. And the reason is no one has helped guide them through the behavioral changes to help them keep the weight off. Our program is unique because it combines dietary counseling, medication, and behavioral counseling to help people make sustainable lifelong changes. Our aim is to create health and well-being. While everyone can stand to benefit from weight management, the people who can really benefit the most out of our program include those with weight-related health conditions like high blood pressure, high cholesterol, and high sugar levels. Support comes in multiple formats. First, we offer a Bluepoint app, which allows you to track your food intake as well as your weight and get important notifications to keep you motivated. Next, we offer individual counseling. Patients can come see me individually. They can also set up to see our dietitian, our exercise specialist, or our behaviorist. And finally, we offer group support. Group support comes in the form of a 12-week intensive lifestyle modification to weekly or monthly group support classes, including our monthly supper club, so that you will always have a place to come together with others for lifelong support. Studies show that group classes are more effective at creating long-term behavioral change compared to just individual counseling. So what we're trying to do is not only help people to lose weight, but to keep it off as well. I chose this line of work because it's very rewarding. I find that food connects us all as people. Food is also either our most potent poison or our most powerful medicine. I enjoy using food to help better people's lives. Being able to help people in an area that has historically been very challenging for them, and seeing the personal growth and change and transformation that they make as their health improves.
my name is Sarah Kelly. I'm a registered dietitian nutritionist here at Bluepoint Medical Associates. As a registered dietitian, I work with our surgical patients as they prepare for surgery and for a full year after surgery. And basically during that first year, we can meet with them an unlimited amount of time based on what their needs are. We provide them support via email, through phone contact, phone follow-ups, and face-to-face. After that year, after their surgery, typically we'll see them every 6 to 12 months from there on out, but some clients like to come back more often for more support or more education, and we're here to help them. Our team of dietitians work with our clients not only for surgical and medical weight loss, but for a variety of nutrition concerns. We help our clients with high cholesterol, high blood pressure, food allergies, gluten intolerance or celiac disease, thyroid issues, polycystic ovary syndrome or fertility issues. Our team of dietitians also meet with pediatric clients ages 5 and up for picky eating, weight issues, food allergies, eating disorders. Our dietitians are ready and willing to help our clients with their nutritional concerns. My favorite thing about being a dietitian is that I love to talk about food and cooking. Most of all, I really love helping people with chronic illness. My background is mostly working with people with diabetes. I've also worked in pediatrics and general weight management, and I find great reward and passion in helping people achieve their lifestyle goals.
My name is Jan Ford. I'm the behavioral specialist for Bluepoint Medical Associates. Many of the surgical practices used to just offer surgery. They would provide you the services for surgery and send you on your way and hope everything worked out. At Bluepoint, we feel that it is much more complicated than that, and that you need a good support system to take you throughout the whole process and not only lose the weight, but also maintain the weight. So we have the support services of myself, the behavioral specialist, the support services of a dietitian, and as well as an exercise specialist to help guide you through the success habits that will help you maintain that weight for the long term. Our behavioral program for the Bluepoint patients, our surgical patients, has several different components to it. We see people first for wellness and a wellness consult where the person will meet with a dietitian, myself, the behavioral specialist, and also an exercise specialist, and be able to have us look at their current lifestyle patterns holistically and be able to make recommendations that will help them have longer-term success. And then we also have a component of a weekly aftercare support group for post-surgical patients. The reason I focused on post-surgical patients is because I feel that people are better equipped to deal with what they're confronted with when they know what that is. And pre-surgically, they don't always know what issues that they will have. Sometimes people think that the surgery will fix everything in their lives. So they're dealing with the realities of the optimal thing is better health, and that it didn't fix everything interpersonally that they hoped. But we do a weekly support group where they have peer support as well as a topic for that week. Also, our Tuesday night group has a Facebook support group that they run themselves to support each other during the week and between the meeting sessions. Also see people individually, do phone coaching as well as the individual appointments. The behavioral part is where that key motivation comes from. And so it's not just about the journey of losing weight, it is about the journey of maintaining that weight loss. What motivates you after you've lost the weight to keep it off, to continue to do the things you know that are going to help you maintain that long-term weight loss? And this is such a joy because I see people just trying to improve their lives one day at a time, one habit at a time. They are motivated, they are ready to change, they just want a different type of a life. And I find that so refreshing.